Hi, I am Niacin. My friends know me as B3. I am one of the 9 water-soluble vitamins in the B family. I come in 2 forms, nicotinic acid and nicotinamide. I was first discovered because of a condition called pellagra, a late-stage deficiency of me that causes dark, scaly skin. Pellagra can also cause diarrhea and dementia. The name pellagra comes from an Italian phrase for rough skin. If left untreated, pellagra can lead to death. The good news is that pellagra is pretty easy to treat. Just supplement with me and some of my B vitamin friends along with a high-protein diet, and you should see an improvement in just a couple of days. Typically, a dose of 500 milligrams of me over the course of a few weeks should correct any deficiency of me. Pellagra became an issue in the 1700s in Europe and again in the 1900s in the southeastern U.S. when untreated corn became a popular food source. The natives who knew how to properly prepare the corn by soaking it in lime juice to make me bioavailable did not have this deficiency issue. Pellagra can still be found in areas of the world where food is scarce. Though pellagra is a late-stage severe deficiency of me, which is currently rare, there is still the possibility of being deficient. This deficiency can come from malabsorption, excessive use of alcohol, medications such as isoniazid for tuberculosis, or mercaptopurin for cancer, and carcinoid syndrome. Carcinoid syndrome is where tumors secrete serotonin and catechol. This increases the need for tryptophan, my precursor, in order to create serotonin. Let me give you a little history of me. I got the name B3 because I was the third B vitamin to be discovered. In 1867, my form nicotinic acid was first isolated in an effort to find a cure for a thiamine disorder called beriberi. This discovery was abandoned until 1915 when Joseph Goldberger figured out that he could induce pellagra with dietary restrictions and then cure it with milk and animal products. Then, in 1937, Conrad Arnold Alvenheim isolated my chemical structure and identified nicotinic acid and named me niacin. After Alvenheim's discovery, grains like wheat and corn were enriched with me to ensure people achieved their dietary needs. My name niacin is an umbrella term for nicotinic acid and nicotinamide. Nicotinamide adenine dinucleotide, NAD, and nicotinamide adenine dinucleotide phosphate, NADP, are both compounds that contain me. They are found in food and act as coenzymes in many metabolic reactions. Though the body can synthesize me from tryptophan in the liver, NAD and NADP must be digested to release me for absorption in the stomach and small intestine via a sodium-dependent carrier. In the body, I can move freely from cell to cell via diffusion, though transport to the kidneys and brain require carriers. Synthesis of NAD from me takes place mainly in the liver, but it is possible in all tissues. How I act in your body. I am used in both redox and non-redox reactions. For redox reactions, I am in the form of NAD and NADP, which act as coenzymes for over 200 different enzymes. NAD functions in catabolic reactions like producing energy from the breakdown of macronutrients and alcohol, while NADP functions in anabolic reactions which synthesize macromolecules, fatty acids, and steroid hormones. NADP is even involved in the regulation of glutathione, vitamin C, and folate enzymes. In non-redox reactions, NAD is the electron donor for ADP ribose. NAD is also the substrate for 2 types of enzymes, monoribosylsulfur and poly-ADP ribose polymerase, which separate the niacin from NAD and transfer the ADP ribose to proteins. For the mono-ADP ribosyltransferases, they function with the immune system as well as in cell signaling. For the poly-ADP ribose polymerases, there are a few more actions which include DNA regulation, stress responses, cell signaling, transcription, regulation, apoptosis, chromatin structure, and even cell differentiation. To flush or not to flush, that is the question. Although there is no real toxic level of me, when I am taken in large amounts, people will experience a sensation called a niacin flush. A niacin flush is a result of vasodilation, which in most people will occur with a dose above 1 gram. This causes symptoms including flushing, redness, burning, itching, tingling, headaches, heartburn, nausea, and possibly vomiting. It has been documented that the flush is not harmful and for some quite beneficial. It should be noted here that my form nicotinic acid produces a flush effect, while my other form nicotinamide does not. Over time, the effects of the flush diminish with long-term use. You can find me in many foods. I am obtained in the diet through nicotinic acid, nicotinamide, NAD, NADP, and tryptophan. The best sources of me are fish, meat, liver, seeds, legumes, coffee, tea, and green vegetables. Additionally, many breads, cereals, milk, and grains are fortified with me. The niacin equivalent was developed to measure the amount of niacin provided from the conversion of tryptophan in the liver, so with a consumption of about 100 grams of protein will equal about 1 niacin equivalent. It is easy to make the RDA of me if you eat a balanced diet, which includes meat, fish, whole grains, along with fruits and vegetables. Vegetarians sometimes struggle to get enough of me, but if they are consuming enriched grains, they should be okay. Otherwise, they should consider supplementation. If you consume too much of me, that's not a problem. I am water soluble, so whatever your body does not need, you can excrete it. I react with many nutrients. Together, riboflavin, B6, and iron are all required for the conversion of tryptophan to me, so if someone is deficient in any of these three, it can lead to a deficiency of me because I won't properly be converted. Additionally, if someone is supplementing with me, they have to be aware of the alkalizing effects, and if they are taking a hydrochloric acid supplement, they should be taken apart from each other. Niacinamide and L-tryptophan appear to treat depression more effectively when we are combined. Supplementing with me. Nicotinamide is my most common supplemental form. This form may improve glucose tolerance. My nicotinic acid form is in both over-the-counter and prescription forms. Types are immediate release, slow release, and timed release. Timed release creates less skin flushing but is potentially more hepatotoxic. This is used for lowering cholesterol. Prescription intermediate release and extended release, and the latter causes less flushing and is less hepatotoxic than timed release. Inositol hexanisinate, which is known as flush-free niacin, in dosages of 2 to 4 grams is not hepatotoxic. This is used for intermittent cramping and Raynaud's syndrome. Clinical correlates. I have been shown to be effective in the prevention of diabetes and in cancer. In diabetes, I am a component of the glucose tolerance factor, which when given in conjunction with chromium can increase glucose tolerance. However, it is important to find that perfect dosage because high doses can actually decrease glucose sensitivity. In cancer, it has been shown that consumption of me can decrease the risk of developing certain cancers. This has to do with the DNA repair mechanisms of the poly-ADP ribose polymerases. In the treatment of certain diseases like high cholesterol, it has been shown that I decrease the production of VLDL in the liver, which ultimately lowers LDL and triglycerides in the blood. Additionally, this will increase HDL. In HIV, those who have the disease are at an increased risk for a deficiency of me, but interestingly, those with the disease who take me in supplemental form show a slower rate of disease progression. In schizophrenia, there has been a good amount of research done showing that the administration of me can reduce symptoms, but it also has been shown to work only in some, not all. Also, I may decrease the inflammation behind acne. Finally, there is some evidence that niacin can reduce acute migraines, chronic tension headaches, and depression. It was very nice meeting you today and talking about all of my amazing benefits. In addition to all of the essential things I can do for you, there have also been some studies that show that I may also be a benefit for treatment and/or prevention of some dermatological issues, cardiovascular issues, ear, nose, and throat issues, psychiatric disorders, among others. Thank you for listening.